Good evening, I'm Gina Gast, and now on the evening news, a jump in COVID-19 cases across our area today. We now stand at 61 reported cases of COVID-19. Each of the numbers you see there on your screen represents a person fighting this virus tonight. Some patients are in their 20s and 30s. Now, others, of course, are in their 60s and 70s. A patient out of Fort Bend County is stable in the hospital, while others are resting at home. And we know in a few cases they likely caught COVID-19 through community spread. This is one of the highest jumps in cases that we have seen in our area during this pandemic. ABC 13's Stephen Romo has the latest on the reported cases.
Those numbers have just continued to go up. Now more than 60 confirmed cases of COVID-19 here in the area. And we're told from health officials we can expect those numbers will rise in the coming days. There are hundreds of tests pending right now, and others may be sick and not even feel any symptoms. Houston's 5 new cases doubled its total. 2 of them have no history of travel. The same is true for the 7 new Harris County cases. They're believed to be community spread, meaning the patients haven't traveled and haven't been in contact with any confirmed cases. That's also the case for one of the Montgomery County cases, a woman without recent travel who's had no contact with other COVID-19 patients was confirmed to have that virus today. Harris County health officials say suggestions about staying home and keeping social distance is all about preventing more cases.
Today's 2 cases are concerning because it's that they are also community spread. So that is our concern, that we are now starting to see community spread.
Now, you may have heard us use the term presumptive positive case. Well, that's not going to be used anymore because we were having to send our tests here locally to the CDC to be confirmed, but now local labs are able to confirm them right here at home. Another reason health officials say you can expect those numbers to rise. Stephen Romo, ABC 13 Eyewitness News.
Well, as reported cases of coronavirus skyrocket across the country, so too is the need for COVID-19 testing. We're working to get more details from healthcare officials on when we're going to see more of those tests. ABC 13's Micah Hatfield has the latest.
Legacy Community Health has 9 locations in the Houston area. If you go to one of them and they determine that you might be at risk of having the coronavirus, they'll send you to one of their locations that's equipped to test you, like this one here in Montrose. They're obviously closed right now, but they have 3 tents like this set up throughout the Houston area, and they tell me they've been testing 10 to 20 people a day at each location.
Even if you test positive, you're not going to be rushed to the hospital unless those symptoms are severe.
Each person who's getting tested for COVID-19 at Legacy Community Health is also getting tested for the flu because they say the symptoms look very similar. Flu test results are back within a matter of minutes. Coronavirus, on the other hand, takes 3 to 5 days and there's no cure. Legacy Health says you'll have to rely on over-the-counter remedies if it comes back positive.
So if you have insurance, we'll process it through the insurance just as we would any other service. We have a sliding scale for our patients who have a lower income, and we also work with our patients who have the inability to pay.
Little information has been released about the county testing sites other than Harris, Montgomery, and Fort Bend plan to open them at some point. One of the factors that has held Harris County up is the availability of personal protective equipment for the people who administer the tests.
We do not have all that ready to share publicly, but we are definitely in the process of opening something, and our goal is to open it this week.
I also reached out to Chamber and Galveston counties today to find out if they had plans to open testing sites, and they said they did not. They plan to just rely on private clinics and hospitals. In Montrose, Micah Hatfield, ABC 13 Eyewitness News.
And we want to make sure you have the facts when it comes to COVID-19. When should you contact your doctor? The emergency signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, confusion or non-responsiveness, or bluish lips or face. If these things are happening, of course, you should seek medical attention immediately. Now, today, people flock to food pantries across our area to get help from different places. People we spoke with say the rush at the grocery stores, job insecurity, and other factors is what drove them out here today. Remember this website, though, HoustonFoodBank.org. That's where you can find a list of resources, including food pantries in your community. Well, with students out of school, parents now becoming teachers and doing what they can to make sure their children are still learning. But some school districts are working on ways to help. ABC 13's Tom Abrams has more on what one district is doing.
It seems almost certain that online or remote or distant learning is going to be a part of the end of this school year for most Texas students. And while large districts are still trying to figure out exactly what that looks like, we did talk to one small school that's figuring it out and managing. The halls and classrooms at Beth Yeshurun Day School in Meyerland are empty. They should be filled with children from preschool age through 5th grade. Instead, the students are at home amidst the COVID-19 outbreak. They're not on vacation.
We had to jump into action really quickly and figure out how we can continue our program.
On Monday, they began offering a mix of live and recorded lessons for their 250 students. It's worked well, and they're tweaking it as they go.
For this week, it's a trial, and that's something that I would advise all schools as they're looking into implementing distance learning, is to take it slowly, to remember these are children who have never learned this way and teachers who have never taught this way.
Of course, it is easier for a small school to pivot than for large districts with tens of thousands of students, some of whom have special needs or no internet access. But this does give us a glimpse of how it can work, how students can interact, engage, and learn. A sneak peek of what the future likely holds for students all across Texas. We know that some area school districts will begin online learning as early as next Monday. Other school districts still haven't released a specific date as to when they'll start, but we do know they're working on it. For all the information about this, you can find it right here at ABC13.com. Reporting from your downtown Houston tonight, Tom Abrams, ABC 13 Eyewitness News.
Well, it's no surprise the COVID-19 pandemic is weighing heavy on healthcare workers who are on the front line of fighting this virus. ABC 13's Raven Amber sat down with the CEO of Houston Methodist Hospital to talk about what they're dealing with.
As healthcare teams work around the clock to treat COVID-19, Houston Methodist is preparing space for its most critical patients that test positive. A closed unit, once used during the Ebola scare, will open up next week with 20 beds. Each room will have negative airflow so that healthcare workers can safely treat each patient.
Obviously, if this expands further, we will then open other units, cohort among other units, and we continue to surge plan for even greater need.
The hospital system already has 2,200 beds that are usually at 80% capacity. Now Houston Methodist is limiting use by restricting elective procedures. Meanwhile, hospitals are working together to ensure staffing needs are met in case staff members become limited.
Typically in disasters or even during normal times, there is coordination about a bed availability and other things that happens on a community level. So if we ever got to that point, that will be coordinated as a community, and what would happen actually is just one hospital might take more people coming into an emergency room.
Raven Ambers, ABC 13 Eyewitness News.
The health experts are saying that social distancing is the key to helping stop the spread of coronavirus, but that can be a challenge. So what can you do if you have to go to work or perhaps the grocery store? Well, doctors say there are still ways to keep yourself healthy in places like those. First, you want to limit the number of times that you go to places where there are more people there. Also, do your best to make sure that you keep 6 feet away from other people. And then another tip is to make sure you sanitize and wipe down hard surfaces that you touch, like shopping carts or your desk. Of course, you should be washing your hands often before and after going anywhere, and include your cell phone in that process as well.
Important that we're not doing activities that are non-essential, but there are things that we need to do. We need to eat, we need to have groceries and supplies, and so when we need to do those things, we need to just make sure that we're conscious of what we're doing. We're considerate of our neighbors and community that are at the same stores as we are. And that includes washing your hands, covering your mouth if you cough or sneeze. And of course, if you're sick, find a proxy, somebody else to go to do those errands for you.
Dr. Weatherford adds, if you can, work remotely. And if you want to be active, you can still go outside to work out or run. Just be sure you avoid large crowds of people and keep your distance. Check now on the forecast. Our chief meteorologist, Travis Herzog, here now with an update.
Should be a pretty mild evening here in southeast Texas with temperatures in the mid-70s and a low chance of rain. A 20% chance of a shower coming our way Thursday. But look at Friday. That's when a cold front arrives, bringing a 70% chance of showers and thunderstorms. A cool and wet pattern continues through the weekend. Most of Saturday dry, but Saturday evening a 40% chance of thunderstorms, which will grow to a 60% chance of rain by the time we get into Sunday morning. Now look, our average low is 53 degrees. It'll be about 20 degrees above that to start the day on Thursday. A very warm finish as the spring begins on Thursday. A warm finish to winter, I should say. 74 is the average high. We're going for a high of 84 degrees. Now, strong jet stream winds and an upper level low are swinging into the desert southwest, and that is bringing the possibility of tornadoes into north central Texas this evening. That tornado watch includes San Angelo, Abilene, and Wichita Falls, but the strong jet stream winds will force all that weather into Oklahoma. Here's a look at future track, which keeps us basically rain-free through the night. We could see a few showers, especially in our northwestern counties, left over from those big storms that come out of the hill country. As we head through Thursday afternoon, very warm and windy around here, but here comes our cold front. This will slowly push through southeast Texas during the day, and the strong jet stream winds will be right over the top of that front, which means there could be some thunderstorms. The best chance of rain still looks to be north of the I-10 corridor, with lower amounts of rain and a lesser rain chance down toward the upper Texas coastline. That cold front pushes offshore Friday night. Towards Saturday morning, we're in some drier air, but the clouds will linger, and then over the top of the clouds, a disturbance will cross over, bringing a higher chance of storms Saturday night into Sunday morning. So one more really warm day before we get a little bit of a cool down for the weekend. Then it snaps right back to some warm and windy weather coming our way by Wednesday and Thursday of next week. Some parts of southeast Texas may be pushing close to 90 degrees. Also, don't forget, you can head to the ABC13 Weather School at abc13.com/weather school, where you and the kids can learn all about our amazing atmosphere while we're quarantined, waiting for COVID-19 to run through.
All right, Travis, thanks. And thanks to you for getting caught up on the evening news. You want to be sure that you join us again at 10 tonight. Good night.